Welcome back. It is a topic that hits close to home for many, including our guest, Jane Brown. Her mother, who would have turned 80 this year, tragically lost her battle with bladder cancer 11 years ago. Now, when it comes to bladder cancer, it's often seen as a disease affecting older men. They're substantially more likely to be diagnosed. But despite the odds, the disease tends to be deadlier in women and often diagnosed at advanced stages. So why is this the case? Joining the roundtable is Dr. Alexandre Zlotta, a world-renowned Uro-Oncologist at Mount Sinai Hospital. Welcome to the panel. Jane, I'd like to begin with your story, and I imagine it's still emotional to talk about.
It is, and part of the reason why, I mean, we all have to die at some point, but when somebody dies prematurely when it wasn't necessary, you know, it constantly upsets you, even though 11 years has gone by. In my mother's case, she was seeing blood in her urine, which is the primary symptom of bladder cancer, well in advance of her bladder cancer diagnosis. My mother was a healthcare professional. She was a palliative nurse. She knew the questions to ask, and yet she was of a generation where her family doctor in a small town in Ontario decided that she should be treated with antibiotics for a urinary tract infection. And this happened repeatedly until finally it became to the point where she was seeing this symptom routinely and was sent to a urologist. But sadly, my mother's cancer had already invaded her bladder and had left the bladder, and so it had metastasized to her lungs. And at that time, now they are saving bladder cancer patients with metastasized bladder cancer, but then they weren't. And so my mom's time was limited.
At what point did she make her way to a urologist finally?
So 3 years before she died.
Okay.
And in the process of treatment, before the chemo, she had her bladder removed and was dealing very well with the life adaptation to have an ostomy, which meant she would no longer urinate in the traditional way. The urine would go into a bag which was attached to her midsection, and she was adapting beautifully. And I think so had she been diagnosed earlier, she would have lived very well with that adjustment in her lifestyle and would have beaten bladder cancer.
Yeah. Dr. Zlotta, can you talk a little bit about why women are more likely to be misdiagnosed when it comes to bladder cancer?
Well, it's probably multifactorial. One of the issues is that women all know that they will present from time to time with urinary infections during their lifetime. And this is going to be a little bit more common than men. And as you perfectly mentioned, bladder cancer affects men 3 times more often than women. And so on one hand, the radar is a little bit less for women, maybe among the general practitioner, as a disease that shouldn't be really high on their radar. And on the other hand, women will present with urinary tract infections that may be seen as indolent and that not worth a workup. But I think the key message here is that if women present with repeated urinary tract infections, this definitely would require a workup to avoid what happened to Jane Brown's mother. And too often indeed, we've seen women who are treated time and again with antibiotics and then new infections, and only too late they come up to show up at the urologist's office.
Are there any other indicators, Dr. Gorfinkel? I mean, it's one thing, I imagine it would be difficult in and of itself to distinguish between a UTI and bladder cancer. Obviously, prolonged UTIs is a big factor. But are there other indicators that people can look out for? Because when it comes to bladder cancer, it's something that affects all of us, but we don't talk about it very often.
True. And not only that, but bladder cancer can happen with a urinary tract infection. The key here is if a woman or a man is seeing blood in their urine, even if we've proven there's a urinary tract infection, it makes sense to go back 2 weeks after completing the antibiotics to ensure that there's no blood continuing in the urine.
That is a step people often miss.
That's a definite step that even GPs can miss. We should go back and recheck it. I'm talking about the blood you can see. The second big clue is repeated urinary tract infections. So yeah, UTIs are a lot more common than a cancer is going to be. But if they keep happening repeatedly, that should ring alarm bells.
It's important as well for women, if you do see blood in your urine, insist to your doctor that you would like to be referred to a urologist. I think a lot of women are hesitant to do that because they may not feel like they have the medical expertise, but it is your body. And really, you need to be your own best advocate.
And even simple non-invasive testing can give us really important information. An ultrasound of the bladder, of the kidneys, because let's follow that path of the urine. It's made by the kidneys where it's dropped down to the bladder and stored before it comes out. And when we see blood in the urine, it could be coming from any one of those areas, from the kidney, from the ureter, it could be a stone, from the bladder. Yeah, it could be an infection, but the infection could be secondary to a cancer. It is important to follow up and make sure that blood is gone.
Dr. Zlotta, how do you advise people should take care of their bladders? What are some of the lifestyle things they should be maintaining daily?
Well, I mean, there are two different things, and some which can affect bladder cancer, some which can affect simply bladder well-being. I think one of the issues that is not too often talked about is the number of young women, even teens, who don't dare to go to the washroom at school and basically keep their bladder over distended. And that is something which is fairly common, and that can end up with some over distension and basically like a bladder which is, and at the end of the day, might not be functioning well enough. The second thing, again, very obviously, remove any risk factor for bladder cancer, the first one being smoking. But the reality on the fact, the matter of the fact is that women now, unfortunately, present at a much younger age with bladder cancer for reasons which are not really clear. It's not completely uncommon now to see women in their 30s or early 40s with bladder cancer. They've never smoked. They have no risk factor. They actually not even present sometimes with a urinary tract infection. And as it was mentioned, blood in the urine should be the absolute warning sign, and to prompt everyone to seek advice.
But preventing those urinary tract infections, simple things like wiping from front to back can prevent problems. Urinating after sexual intercourse, not washing down below with lots of soap. I see this all the time. In fact, whatever vaginal mucus is there can be protective. Certainly not using antibacterial soaps. So simple little things can make a big difference.
Lifestyle choices can make such a huge difference in our fight against all forms of cancer. Okay, quick break. Up next, why breast density matters.